Hi, Maura.
Hi, how are you, Carrie?
Good. Sorry,
I wasn't sure if you were just going to be on here, so I didn't admit you. Sorry about that.
Oh yeah, no, sorry, I was on the phone with a mom.
That's okay. I just got off with a legislator, so I was running a little late trying to get him off the phone without.
I hear you. So,
but yeah, looks like we got a bunch of people joining. Yep. Do I have to keep admitting people?
I can take over. I'm going to, let's see.
You want me to make you a co-host?
Please.
Okie doke. Do more. Make co-host. Yes, got it. Should do it. It says co-host. It might be it says Carrie Mahoney co-host.
Okay, yeah. All right. Yeah, I'm letting people in. So yeah, I'll take care of that. No problem.
And then we talked about you just kind of monitor the chat a little bit.
Yep.
And if there's something that you really want me to address, definitely stop me. Otherwise, I think we'll probably do all the chat questions at the end.
Sounds good.
Just because we do have a whole lot to get through, and it's almost too much. We should maybe do a part B. But I think with with COVID, we can't not address what's going on with that right now in healthcare for people with disabilities. Just added another chunk to it.
Definitely. Yeah.
But I'm just gonna get a little water and then we'll get going because it's 12:01. Okay.
Well, hi, Patsy. This is Carrie. I just want to introduce myself to you.
Paul is here.
Hi, Paul. It's definitely hard to see everybody.
I couldn't get myself off on mute. Sorry.
That's okay.
Nice to meet you guys.
So I don't know, Maura, if you want to share your screen, it's 12 o'clock. So welcome all.
Great.
And I'm going to have Maura Sullivan take it away.
Okay. Hi, everybody. Thank you so much for joining today. I feel like this is just literally my favorite topic to talk about. So I'm so glad that we have an hour together. And I'm gonna get through a lot. So we might try to take questions at the end, but Carrie's gonna look at the chat and she is gonna tell me if there's something like right away we need to answer if somebody really has a burning question. But let's start from the beginning here and I'll pull up my slides. Okay, and just in case you don't know me, oh, we have a couple in the waiting room. Want to get that, Carrie? I'll get it. My name is Maura Sullivan, and I am the Director of Government Affairs at the ARC of Mass, but I'm also the Director of Operation House Call, which I'm sure many of you on this call have heard of. In case you don't know, it's our medical student and graduate nursing student training program in how to enhance care for people with intellectual and developmental disabilities, including autism. And today, we're really just kind of take what we've learned from that program over the last 10 years that the ARC has been overseeing it and kind of flip the script and take what we've learned from families and take what we've learned from our doctor partners, our residents, even our medical students, and share it today so that we can understand kind of the opposite side, and so that we can also learn from each other around tips for really strengthening our relationships with our medical team and our healthcare professionals. And I think now is probably one of the most important times than ever. And also I wanted to mention one of the reasons that I am so passionate about this type of training and sharing this information, because I have two sons who have autism, and one of my sons, I used to say both of them, but now it's really just one, is very medically complex. So we've spent a lot of our lives in doctor's office, specialists, emergency rooms, and inpatient. So learned a lot myself, but really where I've gained the most knowledge is from the families that participate in Operation House Call and have been participating for years and years. So I'll give you a little bit of a background on Operation House Call to start, just so you know kind of where all this information is coming from. And also, I'd really love it if you're a family on here and you are not part of our family at Operation House Call, if you would consider joining. And again, it's our families are of all ages and all different diagnoses, and we'd love to have you. So we're also going to try to accomplish quite a bit today. We're going to talk a little bit about COVID-19, the crisis standards of care revised guidance, because it's important in an emergency, and a little bit about vaccine allocation, although we're not going to know a lot more specifics about our community until Monday afternoon, where we're going to hear directly from the secretary, directly to the disability community, kind of what those categories, those broad categories we've heard about actually mean. So stay tuned, because that's going to be really informative on Monday. And then we'll spend the bulk of our time talking about partnering with our medical teams, and that includes kind of setting expectations, communication from the patient and from the caregiver, how we can improve that, how we can do better. And it's usually I'm talking about how the healthcare provider can do better, but today we're flipping it. And we're going to talk about the importance of the awareness of diagnostic overshadowing and implicit bias. So if you don't know what that is, we're going to talk about that a little bit more. The real importance of caregivers and siblings, and we'll have a whole lot to say about that, and tips from our Operation House Call families. And these I think are the best. So we have 2 slides of lots and lots of tips for us to give to our doctors and new doctors, and then tips for us to remember as we go into the offices and emergency rooms and things. And hopefully we're going to have time to talk a little bit about transition to adult healthcare. We have a lot on the agenda, and I have some great links and resources, and then some time to talk. And I am always available to follow up after if we don't get enough time on any of these subjects. And like I said to Carrie, maybe we're going to need a session 2 or a session B on this. But so let's jump in, and I just want to give you a little overview of Operation House Call and how we've grown and what we're doing really to impact the medical community. So every year we're training about 1,200 medical students, dental students, and graduate nursing students. So that's a big jump from us. We started with only about 200 students at Boston University School of Medicine when the ARC took over Operation House Call about 9 years ago. And then slowly we kept growing and adding students and adding programs. And now you can see the schools that are participating. I put just their acronyms, but it's Boston University School of Medicine, Tufts University School of Medicine, Simmons College, Yale School of Nursing, UMass Graduate Nursing School, and we just started a pilot with Harvard Medical School. So we've really been able to grow this program, and it's 100% because of the families that are involved here and the students that want to learn. They're telling their directors and their deans, we need to learn more about IDD and autism. And the whole premise of the program is families teaching doctors. So we kind of struck gold with this incredible group of families. We're up to 265 across Massachusetts. Like I said before, these families are a mix of ages and diversity and diagnoses. The students go out and visit, and they spend a couple of hours in the home after they have a lecture, and they learn a little bit, gain a little more knowledge, and kind of go through our learning objectives. Then they spend this great one-to-one time. They also have opportunity in the classroom to meet an individual with autism or IDD as well. So the point is that we're growing confidence and interest in future doctors. And one of the reasons why we have such trouble, either in our relationships with our medical community or accessing doctors or specialists, especially for our adults, is because they really have a lack of training. And when they are surveyed around this, many doctors say, I just don't feel equipped because I've never really had any training in this area. So, what we feel like is, well, work with us, we'll work with you. And so that's what this program does. It tells them, don't be afraid, you can do this. And we are seeing that anecdotally, and I can show you some of our outcome data at the end if we have time as well. But anyway, the other goal that's so important right now with COVID-19 and all that's happening in our hospitals is making sure that this program really makes an awareness of the implicit bias that exists and how that can affect treatment and assessment of our loved ones. And then, because we're doing all this really with an aim to decrease health disparities and increase access. And that's the main policy goal here. And I do want to say, as we move forward and talk about, strategies and how to work with your doctor, it's such a wide range. The IDD spectrum, including autism, is so wide. And some of these things will apply for the individual themselves to work directly with their doctor. And some of these things will be for a parent who is really speaking for their loved one. So you can imagine the wide range in between. That's what makes this a really wonderful program, since we have so many different families as well. So I wish that we didn't have to talk about COVID impact, but given that we are really in the second surge right now, I think it's important that we kind of review things. And now versus the spring, we have more data and we have more research on our side. And that research says people with IDD and autism are at a higher risk for more severe disease, or even a higher risk for more deaths related to COVID-19. And what does that mean? Well, it means we need to be prioritized, not only around the vaccine, but around our care. And I remember feeling really worried in the springtime when we were in the first surge, and I was hearing from families, and they would say, well, there's no way I'm bringing my son or daughter to the emergency room if they get sick, because, I hear that I won't be able to stay with them. And, they can't go through that. And I fully understood that. And that was one of the reasons why the ARC and many other advocacy groups jumped on to work on the crisis standards of care. And if you don't know what those were, they were a document that came out from our state and from states across the country. And it helped emergency rooms figure out how to ration care when they were in a surge and care needed to be rationed, meaning things like ventilators and actual person-to-person care. So luckily, I'm not going to spend much time on this because we were able to revise those crisis standards of care and fight that deprioritization of people with disabilities that was either not clear enough in the standards of care, or in some places across the nation, very clear that people with disabilities were at a disadvantage in terms of rationing. and those have turned around in our current standards of care. But the most important piece was turning around, well, I don't know, equally as important, was turning around the accommodations for support. So our crisis standards of care now make mention of the fact that people with disabilities should have a support person with them during care. And this is a breakthrough for all of us. So I put a link to the actual crisis standards of care. You guys are going to get this entire webinar PowerPoint after, so you can click right on this if you want to look at them. They're kind of long. But what I also put in is the ARC's recommendations. So what to do if you need to go to the hospital during this time, and you want to make sure that you can be there with your loved one. I also am going to include an emergency healthcare triage form when I send out this webinar as well. There's a lot of them on the web. And really, I would say the most important thing is to make sure if you do need to go to the hospital with your loved one, that you have a med list ready to go. It's something that's really tough to think of if you're at a hospital that doesn't have their records. And even if they do, they often have outdated information. But it's important to know your rights. Come maybe with the guidance. If you feel concerned, you can check with any hospital that you think you'll be going to, and you can ask them, you know, what happens? I have an adult with autism or an adult with a disability, and I need to be with them during care. And let them tell you their procedures and policies directly. And then you'll have a little bit of a leg up. The truth is they really should be allowing you to stay with your loved one. One other strategy there is to get your primary care doctor, your pediatrician, developmental pediatrician to write a letter that says, my patient needs mom, dad, caregiver, you know, to be present. So other ways to stay kind of prepared for COVID is to write out a plan, you know, whether you have that plan on your phone or in writing somewhere. I think it's better to be safe, and sometimes that plan's going to have to change depending on, you know, how this virus can strike. So have a backup plan as well. And like I said, talk to your doctors, talk to your son or daughter or your own doctor about a plan. Where should you get tested? What's the best emergency room in their opinion if you need it? And you know, for me personally, I had a lot of anxiety around my son's potential exposure and the risks for him. And you know, I put it out there to his kind of lead physician, you know, that I was really nervous, and he responded really well, knowing that it's really important for the caregiver to stay strong during these times and to not feel isolated in what we're going through. We're already isolated enough, having loved ones with disabilities and being in the middle of a quarantine and a surge. And so, you know, we had a nice conversation where we kind of walked through the steps. What if someone gets sick? And, you know, him knowing me and us working together and partnering, he said, let's lay out this plan. If he gets sick, we're going to have a rescue med ready for his seizures. We're going to have a plan in place that you call me. We figure out whether he needs an emergency room or not. So having that dialogue prior to anything happening really helped me relax going forward. And of course, you know, we were lucky because the surge kind of passed us by, and none of these things were super concerning because we weren't needing to you know, to worry about rationing of care. And hopefully we will not need that again, and it doesn't look like that. So in terms of the vaccine, some of you may have seen this, and I know I mentioned that Monday will be much more clarity around this. In case you haven't seen this, phase 1 looks like it includes congregate care settings, which is great if you have a loved one in a congregate care setting, remembering that this vaccine is for over 18. And then the one that really needs more clarity here is the home-based healthcare workers. We need to know exactly what they mean by that, because there's a lot of home-based healthcare workers in our disability community. And you know, it'd be good to know if early intervention is covered, if we're talking about PCAs, if we're talking about ABA therapists, obviously the home nursing and things like that would be covered. So in phase 2, we also need some clarity around what they actually mean by individuals with 2 comorbidities and high risk for COVID, because that's kind of interpretive there. And there's some other questions. Early education, does it include private schools? Is it public only? And then individuals with 1 comorbidity. So what are they actually looking at there? And we're hoping to get that clarity. And then really it looks like April to June before the vaccine will be available for the general public. But again, this information changes pretty frequently. So stay tuned. We'll have more on Monday and then continuously more after that. So, well, I wanted to talk a little bit about language, person first language, and kind of starting off on this because I think it's a great place to start communication with your medical team. Language matters. It shapes our attitudes and beliefs, and it has shaped our policy for decades. I put this visual up here. It's the first one you see in the left there with the pink, is actually a redacted record from Fernald. And, you know, this was not, it wasn't within this century that the diagnoses on this, if you can read it, say idiot, imbecile, idiot. I think this one says blind, epileptic, imbecile. And you can see why our times reflected the kind of treatment that went on during that period. So this is the Fernald State School, and I think all of you have probably heard that there was a lot of abuse. There was physical abuse, there was sexual abuse, there was scientific experimentation done on people with IDD and autism and other diagnoses. And it's so important that we continue to push language forward. So whatever your preferred language is, whatever the patient wants their diagnosis referred as, it's important to communicate that. And every family seems to have a different, you know, kind of preference on that, whether it's person first or identity first. But there are some words that we just want to make sure our healthcare providers do not use, that they're removed out of the lexicon, and that's mental retardation, and most don't, but often they will see it on a medical record. So it's still there, and we still need to remind them, and it's really an okay conversation to have. And it's you know, I put this the wheelchair icon here, because I think that's also an important movement forward, that we're moving away from handicap. We're moving away from that into accessible. And I love this because it looks like this person is on the move. It looks like they have access, that they are mobile. And, you know, I don't know if some of you know Dan Habib and his son Samuel. He's a documentary writer, and his son is in a wheelchair, and he talks about how, you know, people often say, I'm so sorry that Sam is in this wheelchair. And he says, don't be sorry. You know, this wheelchair gives him freedom. It gives him mobility. It gives him the kind of life that he deserves to have. And I think, you know, shifting our thinking around that is really, really important. But even more important in our medical community is modeling person first behavior. So we want people, our medical teams, our healthcare professionals, to look at the person, at the whole person, before just the diagnosis. And that's where person first is so important. If we have time, I'll tell you a story later about you know, how my doctors have modeled that behavior and how important that's been to their staff and to everyone they come in contact with. So let's jump into communication and expectations. I think I mentioned a little bit about the importance of this. I think expectations are really critical. You know, we all want our doctors to respond to us immediately. We all have expectations that they're gonna treat our loved ones exactly the way we want them to treat them. But we also have to have expectations that we play a role in this as well, and that, you know, even if a doctor makes a mistake, uses the wrong language, doesn't have enough patience or time, they can still learn from us as long as they're willing to be open to learn, and they're willing to learn how to do things in a way that will enhance care. Then we don't have to worry about finding a new doctor every time. We can try to work through some of these things, but it is a lot about setting expectations, and sometimes about, you know, picking our battles, right? So in terms of communication, oh my goodness, I think I might have to actually, Carrie, I don't know if you know how to do this, but let me look real quick. I think I have to turn on the volume on my computer before I show you this, and it's super important because I love what Dr. Scotko says here.
Yeah, you need to share your audio.
Right, so I'm on my more screen and I see.
You see the dot? Look under the dots.
Yep, I'm on the dot, and then I see share computer sound. There, I just take a
There you go.
while. Okay, so the reason why I want you to hear Dr. Scotko, and hopefully you can all hear him, is because what he's talking about is from his perspective, how challenging it is to manage the time that he has in the office with his patients. And he's also talking about how important it is to hear from not only his patient, but from their family as well, and how he wants to incorporate that. And I think the script that he uses here is something we can use as parents to talk to our doctors to say, you know, this is how we see it working best. And he's great. I'll let him do the talking here. Hopefully you can hear him.
My sister has a stutter, or sometimes she gets a little bit anxious, so she can't get it out. So I would say with patients with disabilities in general, sometimes we have to have that little extra patience, which is really hard because you have to get in, you're attending once, you get the notes, et cetera, but sometimes by just asking a question and giving extra space to have a person answer it, sometimes starts to get them on a roll and open them up. Because what I realize is with my sister, if she's asked a question and someone doesn't have patience, they move on to the next one, then she knows she's mom, she's given up, like she's not going to be able to participate in this, so she defers to my mom. Or she would be able to kind of warm up, but she needs that warm-up period. Everyone is different. And so one thing I've learned as a clinician, and I only have 45 minutes to get it all done with the patients, is sometimes I'll turn to the person with the disability first and ask them a question. And if we don't quite get it out, then I'll say at the beginning, what would work best as a family? You tell me. I want everyone to feel like their voices are heard. Give me a little bit of insight. And sometimes a family will say, you know what, when he looks this way, it means he's thinking and not that he doesn't have the answer. Or, you know, I might help him out, or we might go back and forth. So we find that families have really, if you ask it in a genuine way, will really kind of cut you slack and say, okay, you really want to learn rather than assuming. So if you don't know at the beginning, I think just being honest and asking.
So I hope everybody could hear that, and I'll just go over a little just because I think it's so important. So doctors they really want to do the right thing. And again, being able to say, you know, for our family, just want to let you know, this is what works best. Let's try to hear from Joe or my son or daughter, and, you know, I'll fill in when I think he needs it. Or, you know, you're gonna, you know, have to listen to me because, you know, my son or daughter isn't going to be communicating today, but certainly paying attention, eyes on them, looking for reactions. It's all so critical. And I think in relation to that is, just knowing that families really are the experts. And, when communication is difficult, we know body language, we know sounds, we know, all kinds of things. We know from just eyes, eye gaze, what's happening with our loved ones. So it's important that we are able to share that and partner with our physicians that way. So I just love what he says here, and I think it's so important. So talking a little bit about raising the awareness around implicit bias. It is real, and we saw the effects of that across the nation pretty clearly with the deprioritization of people with underlying conditions and disabilities. And so we need to do more education and awareness around it. I don't know if you guys have ever heard from your doctors or from anyone, oh, well, that's part of the autism, or, oh, that's just part of the syndrome. We need to turn that around, and we need to say, the diagnosis is part, but it's not all. And we have to look beyond those behaviors, and we have to teach our medical teams to do that as well. So for example, people with autism often have self-injurious behaviors. They can have aggression. They can have vocal stereotypies where they're very, very loud. They can have physical stereotypies or stimming. They can have sleeplessness, sleep disorders. And many of these things are really underlying conditions of pain or discomfort, and these behaviors are communication. So it's so important that our doctors know that any of these behaviors can be a communication and needs to be looked into more. And that's what we can call diagnostic overshadowing, when a doctor might say, oh, that's just part of the autism. And really, for example, my son, he will do a lot of punching of his chin when he has reflux. If he feels that acid coming up, he has a very hard time telling me, but he will become self-injurious. He also doesn't want to lay down for bedtime, because if he lays down, that acid comes right up. So we try to talk about that and say, let's look beyond the behavior that's sometimes typical in autism, but can often be a sign of pain. And the same is true in so many other diagnoses. I've heard from so many families who have an adult with Down syndrome, and they're noticing changes like exhaustion, like fatigue, slowing down of language. And they go to their doctor and say, I'm worried about these things. And sometimes the response is, well, that is part of the syndrome. And we know for sure that sleep apnea is a major issue for adults with Down syndrome. And it's up in the 90 percentile of people that have some amount of sleep apnea. So without doing a sleep apnea test, without treating for sleep apnea and just letting that go as part of the syndrome, we aren't looking beyond behaviors, and we're letting bias come into play. So these are things that we can teach our doctors about, and the importance of it. And teaching by example, and reinforcing those who are champions for us, who do this in the field. And I'll tell you a quick story about a doctor who actually caught us at a really difficult time. My son and I were in the emergency room, and some of you heard this story, and he was having a very difficult time crying and screaming and kind of aggressing on me and his dad. And a patient in the waiting room stood up and said, you ought to have to put a muzzle on that thing. And of course, every bit of strength I had just left my body. And I thought, how can I possibly get my son through this emergency room appointment. And, but really in my head, I was thinking, how am I ever going to get him through life? And this doctor came out and he escorted the patient to another waiting room, to a private room, I think. But he came back out and he came right over to Neil. And he bent over and he put his hands on Neil's elbows and he looked right at him and he said, Neil, I am so sorry that you are hurting. And I'm so sorry that you have to wait. But I'm going to help you. And I'm going to help your parents because you deserve it. And then he stood up and he made eye contact with everyone in that room. He looked around at the patients, he looked at the staff, and the impact that he made in that one moment was so great. It was an impact on me as well. I thought, you're damn right, he deserves it, no matter how much he's screaming. And you know what? People came up to me and they said, you know, what can we do to help? How can we help your son? What's going to make him comfortable? And I thought that man, that doctor, he really changed the culture. And I made sure that I tracked him down and I wrote a thank you note to him. And I said, you know, you not only changed our experience, but you changed and you shifted things for so many people in that room with just that behavior. And the more doctors we can have, and the more nurses and the more medical community people that will stand up and do things like that, the more we're going to change things. So reinforce that with your doctors. Tell them what an impact they have, and thank them when they do things to stand up for you, for your sons or daughters. So this is one of my favorite slides. Now, some of these things will work for some families and others you're just going to leave them and they don't work for you. But if there's a couple on here that will help you going forward, we have 2 slides of tips and we're just going to go through them real quick. I think people know that sometimes it really helps, no matter what age your loved one is, to demo or to really explain what's going to happen when you're in an office visit. So communicating that to your doctor is really important. Let them know, model on me first. Bring a toy. My son's pediatrician will do an entire exam on his Toy Story Forky toy, which is a tiny little toy. But he's willing to do that because it eases my son. It builds their bond. And that's what's so critical. Some people really respond better to dim lights. So if you can make that slight adjustment in the office and it's going to help. These are things that doctors want to know. They want to know what will help. And again, just explaining what's going to happen first, that often works for folks. We have some people with disabilities who will say, don't tell me what's going to happen, just get it done. But this is, you know, where the communication is key. And then what Dr. Scacco mentioned about time and patience. It's so important. Just when they think that's been enough time, it's still not enough time. That processing time is so critical. And I think what Dr. Scacco said was, if that time isn't given on the front end, then you know, often the patient will just give up and say, oh, I'll let mom handle this, I'll let dad handle this. And we want to do everything we can to get that engagement. Getting to know what comforts your patient is so important. I know I have one family who lets the doctors know, new doctors reminds old doctors that if you just have a deck of cards, that's going to keep him calm. That's going to entertain, and the good doctors will remember that. And having them think outside the box and not let perfect get in the way of good. And the example I have there is, you know, if the patient doesn't want to lay back on the exam table, but we try to force this, and it's, you know, so important before they, you know, leave. It could end up that we leave without any exam if we push that. So being able to communicate kind of the give and take here. I know I have a dentist who would see my son standing up in the room, because once he got on the chair, the anxiety got too high. Is it as effective of an exam? No, but are we getting something? Yes, and we'll work our way back to the chair. Leaning on parents and siblings. So, you know, the doctors need to know that we always have a solution, an idea. So look to us. You know, is it giving the person a break? Is it working through it quickly? We're going to help them understand that. And then, you know, really important to talk to the staff about scheduling. Being flexible. What would work best with their waiting room situation? Are they willing to do something like text when the waiting room is more empty? Text you when there's, you know, good chance you have less time to wait? Or is it having a visit right after lunch, the first visit, or the first visit of the day? Or often my pediatrician will give me the last appointment of the day. And honestly, he has even come out to my minivan and done, you know, ear exams in there to help. So thinking out of the box and being flexible is so critical. And then as families, you know, what can we do to help our appointments be more efficient? What can we do to help educate our physicians? You know, there's lots of things that we might not be thinking of. So I know one of them is there's a problem going on and you want your doctor's help, take some data on it. Have some real concrete information to offer. I know I use video a lot to catch things and share them that way. But tracking it is really key. It will save time and it'll put you kind of right into it right away versus trying to explain how many times it might have happened or explain what the behavior looks like or what you're concerned about. Just show them. And then, you know, I think most people do this, but especially if you're going into a new doctor or making a transition, you know, a one-pager is really helpful. So you don't have to have every bit of their history, but just kind of the most salient things you want a doctor to know, either for that visit or kind of just going forward. What works, what doesn't work, what are the main issues? I put that one in from a family who brought this to my attention. Mom said, you know, don't spend too much time complaining to your doctors because we want them to value the things that we value, and we value the little bits of progress that happen with our kids and our loved ones. And if you talk a little bit about the things that you value, the progress that your loved one has made, maybe, you know, they're getting better at wiping independently, and I want to share that with you. Your doctors are also going to value the progress they make in the office, the little bits of progress. So I thought that was a good tip. To try not to remember not to do too much complaining, and really bring out some of the positives in what it's like to parent your child. Or and don't forget the power of reinforcement. Don't forget to bring a reinforcer for your son or daughter, but also thanking the doctors, thanking the staff when they do a good job, because there's going to be plenty of times that you're going to have to tell them the problems that you're facing. So thank them when things are going well. Share maybe 2 ways to make the office visit go smoother. So you can always bring that one pager, but you may want to verbally say, here's 2 things we can do today to make things easier. I think when you start getting to more than 2, it gets a little tricky for them to manage, but kind of the 2 best things that they could do. And again, from Dr. Skockel, if you want your doctor to address your child or adult directly, you gotta tell them, you know, don't expect them to do it and be mad if they don't do it. Let's just tell them straight up, I want you to talk directly to my son or daughter. Talk to Joe and, you know, let them know. You'll jump in where you need to. You know, and then if your son or daughter is independent, it's really important that that relationship grows, and that For example, you know, I have one young man who is transitioning into adulthood, and he wanted to do his first primary care physician appointment by himself. And the difficult part was that the doctor, A, he didn't have the patience that he needed, and B, there was no prior information given, no handoff from the pediatrician to the primary care doctor to kind of give a heads up on certain things. And this young man was doing great until history came up, and there was a question about cancer, history of cancer in his family, and it was a bit of a trigger word for him. And then he just kind of fell apart there. So being able to sort of get that information out ahead of time and know that a doctor really does want to help. So again, we got to ask for flexibility in scheduling if they're not just going to give that to us or think about that ahead of time. And let's see, I think just for yourself, if you can't get help in the office to come with you, then maybe you should try to get some help before you leave. Take time to organize, take a breath, those kind of things. So I thought these were really great tips from our families. And I'm sure you all have a whole lot more as well. I know we're getting up to close to some time that we want to make sure we have time for questions. But I did want to talk about caregivers and siblings. Like we mentioned before, we are the experts, and we are in this for a lifelong journey. And the thing about it is, I think it's very important that our doctors who take care of our loved ones understand that stress-related disease is a real thing for caregivers, and PTSD, and combine that with aging. And they need us to stay strong. We need to stay strong. And sometimes those doctors are going to see when we're not. So it's important to listen to them. We had a healthcare transition conference last week. It was a statewide conference on transition for people with IDD. And the keynote speaker was really lovely. And she said, you know, this is not really a journey for families. This is an odyssey. You know, it starts young and it goes through so many mountains and roller coasters. And parents do have a lot of stress from kind of chronic crisis that they've been in. Some say that parents with a child or a loved one with autism have PTSD levels that of combat soldiers. So we need to take care of ourselves. This keynote speaker also said that sometimes she sees parents who can't see that they're in an unsafe situation, and that she feels like it's a very difficult conversation to have. And I can understand that, but it is important that it's a two-way communication. So listen to your doctors too. And then, you know, siblings, it's so important that our medical teams understand that siblings can be kind of there for the longest across the lifespan for their loved one, that they might be caregiving a lot of the time, and that they may end up being the guardians. Their health and well-being also needs to be a priority, and that can sometimes be challenging. A lot of siblings feel that, you know, maybe their issues are not as extreme, or that they can take a back seat, or that the stress is too high around their sibling and that they should just kind of manage on their own. And, you know, obviously it goes both ways. It can be siblings who say, you know, hey, don't forget me. But the other great thing about siblings in an office visit, or, you know, during care, is that they have really high expectations for their brothers and sisters, and bringing their perspective in is important. So wherever you can, if you have a sibling who's willing, bring them in and let the doctors get to know them as part of the family. A very important part. So good, we have a minute to just talk about transition to adult healthcare. And I'm gonna also add a nice link that conference I was telling you about. And just incredible amounts of resources there. So hopefully you'll be able to find that helpful. But when we're thinking about transition to adult healthcare, really have to start thinking about self-advocacy skills. And no matter where you are, 10, 12, 14, 16, 18, start working on those now. How can an individual advocate for themselves around how they're feeling in the office? If they feel comfortable with their doctors, how can they help identify pain? Can they start taking care of themselves in any way? And self-actualization is part of that. How self-aware is your son or daughter or patient of their diagnosis and what that means for them? And is there anxiety? Is there discomfort around it? And how do we work through that before they're in an adult healthcare setting where maybe mom or dad or close caregiver is not always available during an appointment? So these are all important things to work through with the primary care, pediatrician, developmental, and it's also okay for that person to move into adult healthcare and need supports. Obviously, there's lots of individuals who are going to need support for their lifetime. And I think I mentioned this earlier, not to judge a provider around what they don't know, but as you make these transitions, judge them on how receptive they are to learning. And really work on getting a handoff, from your primary under 21 provider to your adult care provider. There's so much important information to transfer over, and that's the least that they can do. And I hear all the time that people just make a jump without any conversations. And it's really nice if you can make that jump to a family healthcare provider that already knows your family, or someone that you already trust, who's seeing other friends or members of your family. But sometimes you're making a jump. And this is a really huge problem in our community, is finding doctors who we can trust to take care of adults. We have a bill that's pending, and we had a lot of testimony for it last year on hospital training. And part of the testimony was that access for adults is really in dire situation. And I think UMass Medical School called almost 1,000 adult primary care doctors to see if they would be willing to take on a patient with autism. And sadly, they got an extremely low, like 20 doctors said they would be willing. And when they asked why, again, the comments were just that they didn't feel equipped and they had never been trained. So just all the more reason to have training available and to work with these doctors. They're willing, they just need to feel comfortable. And so one of the links I put in here that's really important is the disabilityinfo.org link. If you're looking for a primary care or specialty doctor for an adult, this is a great place to start. It allows you to search. They're constantly updating it. And anyway, it has a million other great resources as well. So I would love to just kind of expand on transition to adult healthcare in another webinar at some point. But I definitely wanted to take a little time now to have a discussion. I wanted to give you a few resources just so you know when you look back on these, what they are. For Operation House Call, we have a wonderful website that people probably haven't seen. Even if you're an Operation House Call family, you may not have seen it. It's operationhousecall.com. And we have really wonderful, rich resources that are clinical, that are family perspective, that you can print and share with your own doctor. We have information on person-first language, on delivery of diagnosis, on comorbidities that come with IDD, just a whole range, and not to mention some really wonderful documentaries that you can watch for free on this website. So there is a privacy part of this website that you wouldn't be able to access, and that's where the students go to write their reflections about their experience. But the rest of the website is open to the public. So feel free to check that. One thing we didn't talk about was the importance of kind of knowing your insurance, and that can take a huge load off your relationship with your doctor. And if you have insurance questions, I put this link because they are the insurance gurus over at Mass Autism Insurance Resource Center. And it does have autism in the name, but really that any insurance related problems or questions, you can go there and look at their website or contact them. They're really wonderful. And the last link I want to give you is because we want to do better one-to-one with our doctors, but we also want to make things better across the state. And so we have a couple of bills that we would love your advocacy on. And in the next couple of weeks, we will put up our 21-22 platform that will have actually our healthcare bills prioritized as number 1 and number 2 on our platform. So one is to continue to train medical students, and the other is to train hospitals in how to respond better. And so if you're interested in advocating in a bigger way, definitely check those out. And I'm going to stop the share now. And hopefully you guys have some questions, and I'm sorry I only left about 6 minutes for questions, but Carrie, I see some in the chat.
Yeah, there's, Lucy was wondering about if there was any guidance for accessing medical care for those who cannot wear masks.
Mm-hmm. Yes. So are you meaning like as you enter an emergency room or, with your own providers right now? I think both are a problem, Lucy. And actually, I know there's some organizations right now that are working on that. We're actually hearing that there are some providers that are refusing to see patients with IDD across the board because they're afraid of the non-mask wearing. And so it's super important that we look into this and kind of get a sense of how much this is happening. I would just recommend always calling in advance and letting, office people know. They're usually the ones that are going to stop you at the door of the limitations. I think that's the only place we can go right now, except for I know the Disability Law Center is working on this all the time. And so if you have a specific problem, definitely contact the Disability Law Center. They have sort of written information that you can give, and they've been on top of this one from the beginning.
Okay, thank you. And then Munir just wants to thank everyone for the topic, and she just wishes that she would ask the doctor beforehand, how much time do we have, so she can prioritize, because it just seems like, you get going and then there's the next appointment. So
that's actually such a good point. Yeah, just understanding yourself how long, because the Dr. Scocco in that interview, he said, I only have 45 minutes, but when I talk to doctors, they say, I have 15 minutes. So, want an intake versus a regular appointment, but definitely good to know that. So thank you for that. Yeah, and that ER doc, I agree.
And Jean was sharing that they have a nonverbal son with significant challenges, and when it was time to transition from pediatrician to PCP, she and her husband did several interviews. Right away there were some we knew wasn't going to be a great fit, but she appreciates the presentation today, and your ER story, Maura, warmed her heart.
Yeah.
And we have both good and bad news, bad experiences at the ER. So thank you, Jean.
Thank you, Jean. Yeah, and I would recommend that interviewing as well. And like I said, they may not have all the answers, but if you get that sense from someone that they're willing to work with you, I'll just mention that, my pediatrician actually missed the diagnosis of autism in my son. for quite some time. And, you know, when he finally did get diagnosed outside of him, of course, he said to me, you know, I'm really sorry that I missed that diagnosis. He said, I had never seen a kid lose skills before. So I really didn't know what I was looking at. And he said, I really want to learn more about autism. I want to learn from your son, and I want to learn from you. And I'm going to do my best. And honestly, no truer words were spoken. And this pediatrician has been an angel in my family. So I'm so glad that I didn't let that get in the way, that I didn't feel angry about that, that we worked through it together, because there really hasn't been anyone that's been more supportive of my family. So yeah, so I love that idea. Oh, I love to hear more interest in Operation House Call. Yeah, so I put on the slide there how to get in touch with Kim Walsh. Her name is, I just put Walsh at arcmass.org, but it's Kim. And she is my guru program coordinator, and she'll set you up and tell you all about the program. Right now, obviously, we're doing all virtual. And but one of the things I wanted to mention about it is that parents have, and obviously lots of individuals that partake in this program, have talked a lot about how it's helped their advocacy skills grow. So parents spend 2 hours talking to medical students, and the individuals talk to them as, you know, in the classroom and at home, and siblings get involved. And then they go to their own doctors and they find themselves like really advocating better for their own health care. And I thought that was a great, like, sort of side effect of the program. Because we all need to be better advocates for ourselves as well. So yeah, so I see, Jean, about the Berkshires. And we did try to do a trial out there a few years ago, because we have a few medical students from Boston University that are like stationed out at Berkshire Medical Center. So we did build a small little pilot around them. But again, it was really, really difficult with the travel and keeping that up. But we also have some leads out there for a medical school out there that's a school for osteopaths. So we may revisit, you know, when COVID kind of calms down. Yeah, it would be great. I would love to get us out west. So any other questions? Does anyone want to just unmute? I know this was a ton of information, and we kind of barreled through a lot, but please feel free to follow up with me on any of these areas, on the COVID information, on, you know, just any of the tips that are interesting to you, and absolutely any of the healthcare transition stuff. And I know there's a lot of links. So
Elliot, was it?
who's that?
I hope not.
Hello, is that you, Jesse? Oh, I can't tell who that is, but sorry, does anyone have any last questions before we wrap up? Okay, you can always contact me or Carrie, and thank you so much for spending this hour together, and I hope everybody stays really safe and healthy and has a very peaceful holiday.
Thank you so
everybody.
much.
Thanks, Kelly. Thanks,
I
Paul.
appreciate it.
Stay well, everyone.
All right, bye.
Bye-bye. Thank you, Jean. Thanks, Carmen. Take care, everybody.